There's no reason in my mind that a 65-year-old woman can't be really hot and still look like a 65-year-old woman. Just great. You know,
Yeah.
the miles, and she knows what's going on.
Yeah.
And just beautiful. My start in plastic surgery, well, it was kind of a different plastic surgery world because I started in the mid to late 70s. And the plastic surgery wasn't something people talked about.
Mm-hmm.
You know, it had just, if you will, come out of the closet, and people beginning to get open about it. But prior to that time, prior to the kind of after the Second World War until the mid 70s, the only plastic surgery that people ever spoke about was reconstructive surgery, and about people in accidents or war injuries or burns and that sort of thing. And cosmetic surgery only became popular and often spoken about publicly in the mid 70s or early 80s.
Mm-hmm.
And so for me, I was right at the crest of that wave, which was interesting. And I trained in New York at Cornell at New York Presbyterian Hospital. It was, at that time, it was called New York Hospital. And I stayed there for my entire career. But I've always had my own private clinic. And things have changed kind of in hospitals over the last decade or two, so that now the residents come to us to watch us operate rather than us teach them in the hospital. So most of my practice these days is clinic-based. It's in my own Upper East Side clinic, and kind of a very substantial place, unusual for New York.
Mm-hmm.
And I have wonderful staff, and it's a pleasant way to work.
So thank you for that. How long have you been performing plastic surgery?
No, almost 50 years.
50 years.
Yeah, almost.
Yeah, I think you forgot more.
I was a general surgeon before that. I was a surgeon in the Air Force before that.
Mm-hmm.
You know, I got around.
Well, 50 years. I feel like you've forgotten more about medicine than most people will ever know.
Well, at this point in my life, I try not to say I've forgotten things. But
yeah, that's important. That's important.
But the reality is that plastic surgery is, if you will, knife and fork surgery. You know, it's not robotics, and there are no fancy instruments. It's about the experience, taste, and ability of the surgeon. And mixed in there has to be something that is kind of absent a lot, and that's called common sense. And if you mix all those things together, then plastic surgery is wonderful for everybody. Mm-hmm. And if one of those elements is missing, it's very bad for everybody.
Mm-hmm. Mm-hmm. Understood. So originally, I know you were going that direction with my question. What inspired you? When did you realize you wanted to be a plastic surgeon?
Well, I never did really realize it. I'd gotten out of the Air Force, and I was finishing my surgical residency, and I moved out to L.A. because my wife at the time had grown up in Los Angeles, in West L.A. And I thought maybe we would settle out there. And the chief of surgery at the hospital in which I was working was a really wonderful guy and a great surgeon. And one day he suggested that I become a plastic surgeon because I was kind of too crazy to do anything else. Because when I would operate, all the sutures I would drop in the same way. It was kind of like a ballet, and everything was at the same length. And it just had to look beautiful at the surgical field, because that's my nature. And I'm not claiming to be the smartest guy in the world, but I was given this gift of being able to do surgery easily. It was intuitive, like savant work. And he called a friend of his who was the chief of plastic surgery at Cornell, and he said, "Hey, I have a kid for you." And then he said to me, "I want you to go see this guy and think about this." And that was my career.
Wow.
It's just quite amazing.
Yeah, quite amazing.
It's
Uh,
just, there are moments like that when someone sees something in you that you didn't know was there and acts on it. And that's kind of
that's right.
nice.
Well, that happened for you. It's always nice to have someone looking out for you in what seems like your best interest, had your best interest at heart.
Yeah.
Now, have you done a lot of mentorship for people
Oh,
that have
yeah.
come in? Yeah.
Yeah. There are hundreds of plastic surgeons who I've touched over the years, but any number of fairly prominent plastic surgeons now have been my students and have worked in my office for a few years until they went out on their own.
Mhm.
I have great pride in that. It's a nice thing. You feel good.
That's a beautiful thing that you're helping so many come after you, and you're planting seeds that are going to be, flourishing for years and years. What do you look for in a young surgeon that you say, wow, this person could be special? What are you looking for? Maybe two or three things that you say, there's a bunch of surgeons, and I know there's not a lot of them, but in the pool of surgeons, you say, I can see these things in this person.
First of all, enthusiasm
Mm-hmm.
and honesty.
Mm-hmm.
Enthusiasm because work and training as a surgeon, I mean, it's just endless. It's every day is a long day. And in my day, it was 36 hours on, 12 off.
Wow.
So it was hell. Now it's less. But the enthusiasm, the love of what you're doing is the first thing. And then the willingness to run the other mile, the extra mile. Because there are people in plastic surgery who see it as gravy train and they're interested in immediately going out and becoming famous. And there are other people who say, man, this is great. I can't wait to learn to do this. How did you do that? Can I help you? And you just get the sense of the people that you want to have around you and the people that you'd like to have not bother you. It's just, you see that in your world. There are just people who want something and people who want to give something, and they're different.
Yeah. Yeah, that's very well said. Very well said. Enthusiasm even to maintain your enthusiasm. 'Cause every time I watch something with you in it, I can tell you have a genuine enthusiasm for what you do and you're
I love
passionate
it.
about it.
I
Yeah.
love it. I mean, I don't have to do this anymore. I've done it for a long time. I can quit. But I always say that I'll quit as soon as I see someone who does it better, or I'll quit the day I don't love going into the operating room, and I love it because I have the unique situation where I can choose my patients. I don't have to deal with people that I don't like or who don't like me because part of that, you know that in your world, part of that is when you're meshing when it's right. So I deal with people who know I care about them, and I do care about them, and it works both ways. So that I love to go to work. I mean, it's really great. And then you make people happy. You see an immediate result, and you get paid for it. What could be better?
Yeah.
It's great.
Yeah. Getting paid for what you love to do is special for sure.
It's shocking.
Yeah. So I think of the Seinfeld episode when he says, George Costanza says, I still can't believe I get paid to do this.
Yeah. I say that. I say that every day. I
Yeah.
say it every day,
Yeah.
and it's. I think it shows in the way my whole staff is because we all love what we do, and when you hear about people who say I can't wait to retire, I feel sorry for them because they've spent their whole life trying not to do what they're doing,
Mhm.
and here, I mean, I enjoy every day, and what a gift!
Yeah.
What a
Yeah.
gift! Yeah.
That's a great reminder. You mentioned before, doctor, that you were 36 hours on, 12 hours off. Am I allowed to ask you how many surgeries or how many hours you do in the surgery room today,
No.
nowadays?
Not much.
Okay.
I tried to. From when I went into practice, I already I had two or three had two children already, and and a lot of financial pressures. But I never wanted to be the richest guy in the world. I wanted to have a rich life. So I only operated in the mornings, and I always had something else that I did in the afternoons. whether it's teaching or writing or racing sailboats or playing polo or meeting people or having lunch or, I don't know, chasing girls or whatever the heck I did when I was young. But I always had a life. And I think that makes you a better surgeon, better at what you do, because I feel like I'm there doing my job when I want to do it. I'm always available, always. If I have to come back, if I have to do something. For example, I never have a glass of wine at lunch because for two reasons. A, I never know when I have to go back, and B, it doesn't look good in the neighborhood. Okay. So,
Yeah.
Because I know everybody on the Upper East Side, and they say, "Oh, look at this guy! He's putting him down at lunch." So, in all these years, everybody will have a glass of red wine, with a bowl of pasta, and I just Diet Coke, right?
It's interesting you said that. I remember being out in Miami, and a person I knew had a doctor with them, a surgeon. And I saw some of the behaviors of the surgeon, and the person I know was saying, "This guy's the best. He's the best doctor. He's the best plastic surgeon." And I was watching his behavior, and I remember thinking, I don't know what he does, but to me, he's the worst surgeon because of his behavior and the way the things he's doing in public, which was not great. Some really terrible habits, which would definitely alter his ability to perform on the job, at least the next day.
That's terrible.
Yeah,
you can feel it. You can feel it the next day.
Oh, I can't imagine.
That's not good.
Yeah, yeah.
I mean, my day, it starts early and it starts in the gym, and I try and write for an hour, and I try to be in the gym before I go to work, and I like to feel good in the morning.
Yeah, for sure.
I don't have a headache.
So that's interesting. You have such a job that revolves around precision. And I heard that you like to get good sleep. So I'd ask you about how much sleep you try to get. And then I'd like to ask you about your training. And then please.
Sure. Well, sleep, what every surgeon can fall asleep standing up. It's what we learn to do. We were residents, we'd sleep on a gurney, we'd sleep on the floor, anything to grab an hour. And that's a habit you always have. So I can fall asleep at any time. And I try and go to sleep early so I can get up early. If I get 7 hours sleep, I'm fine. If I get 8 hours sleep, I'm almost too rested. So, but seven to 8 hours, and if I get 6 hours sleep, it's not enough. And I kind of know myself by now.
And
how much sleep do you get?
Do I? I go to bed about 9:30. If I can go to bed at 9, I'll go to bed at 9. But we have a child, so my wife does all the work, but we try to put him down together. And I wake up early. I wake up about 3:15, 3:30 in the morning.
Whoa.
Yeah, and I train. But I will tell you that my patterns are insanely consistent. So I feel really good. I don't feel bad. Now I know if I got another hour, and I try to do that. Like I'll try to pick up a half an hour at night and in the morning to add an additional hour. I just know that I really appreciate the peaceful time in the morning. It's really special to me. And I enjoy that. And that kind of sets the foundation for the day where I'm ready to be my best for others. So you said you train, and I train before I have to face the world. You train every day?
I don't anymore. Probably 5 times a week.
Okay.
And when you say you train and when I say I train are two different things. I mean, I just try to I try to stay even and get my blood moving and stay even and feel good in the morning. Mm-hmm. And I've been kind of the same weight for my whole life.
Okay.
Although I used to be an inch taller. And I think that it's partially aging and partially all the years of riding.
Oh yeah.
It's terrible.
Mm-hmm.
But so my goal is I work out the same way. I do same 8 or 10 exercises every morning. Mm-hmm. I do intermittent cardio a few times a week. Not a heck of a lot of that. Okay. But resistance training is critical. particularly critical for someone middle age and beyond. And you set yourself up for that best by starting when you're young.
Yeah.
Have it, you're in good shape, and you know,
Yeah.
it's critical.
I agree with you. It's certainly resistance training is critical, and I heard your power list of top exercises, and I'd like to get into that in a little bit.
Sure.
But what is there any other? By the way, you mentioned polo several times.
Yeah.
That to me appears to be very challenging to do. How do you still play?
No.
Okay.
I had a terrible injury in which my some idiot hit me in the neck and broke my larynx, and
Wow.
I was in the ICU for a while. So after that, by the way, I had this sexiest voice in the world for about 6 months. Till it came back. My normal voice came back. But after that, I said I have to get back on the horse. I can't be chicken. And so I played for another year or two after that, and then I quit. Playing polo at the level I played, it was pretty intense. And you play with the same group of people, a couple of dozen people, but it's like they're all the same guys in the foxhole with you. It's really war, and afterwards you all care about one another. And we were at a dinner party one night, and there were half a dozen of us, and one guy said, "I'll quit if you quit." And we all stopped playing the same day, the same night, because it's so demanding and so dangerous and so wonderful. I mean, it's you see it in Palm Beach and Miami, the polo there. I played in Palm Beach for 15 years, and it's so exciting.
Yeah, to me it's fascinating. Such a blend of like focus, agility, balance, everything.
You left out the most important part:
Tell
good
me.
horse,
Good
because
horse.
the horse is so much more important than the player.
Mm-hmm.
And what I learned, I was kind of friendly and took care of a whole bunch of the 10 gold players and their families, because they would always break their noses. I always took care of them. And I learned that somebody on the field has to know what to do. If it's not the player, it has to be the horse. So the horses that I would get were older horses that were no longer good enough for the great players.
Okay.
So I'd get on these horses and they teach me the game.
Wow.
It was very simple. And they would make sure I didn't get hurt, never got into accidents, that sort of thing. It was an interesting strategy. And the game itself is almost like a chess game. And there are 4 people on each side. And traditionally, the guy paying the bills, the patron, is the weakest link, and they put him up front. He's number 1, and you're supposed to hit the ball to him. He's supposed to try and get into the goal. I never knew what the hell was going on. They were all going too fast. But when I played in the back, I could watch the game.
Okay.
Then I knew what I had to do, and then I became a reasonably good, fairly highly rated amateur player, because I actually could keep up with it.
Right.
And so I played in various levels until I got to a point in Palm Beach polo when we were playing 20 gold polo, and it happened so fast I don't even remember being there. So I said, I'm not good enough for this. Found my level, and played for another decade like that. It was wonderful.
So it's fast. That's fascinating to me. You mentioned how when you get on a veteran horse, they teach you the game, and it makes your job a lot easier.
Yeah.
Yeah. Well, that makes perfect sense. But you've done, is it 25,000 surgeries? More? Less?
Yeah, maybe more.
More. Is it, what makes the surgery successful? Is it, you're because you walk out of there and going, man, I just really nailed that one. I just know I did a good job. Everything was pulled perfectly tight, incisions, or is it the patient's confidence in because I might imagine there are some people out there who, no matter how great you do, they're not going to be happy. But that's how they approach it.
Well, you learn that. You're so right. But I'll answer the last thing first. You learn to avoid that with experience. When you're a young plastic surgeon, anybody who'll sign on, you want to operate on. I mean, you're just desperate to work. But as you get more experience, or you see red flags,
Okay.
you try and avoid those people. I think I do a pretty good job of avoiding them. People who have unrealistic expectations, that you need to avoid them at all costs. But I think that when I finish an operation, I look at it. I don't leave until I think everything looks great, and then that night or later on, I'll say, I could have done something better. There has to be a better way to do this. There has to be a better way to do that. And that really is what drives me. I don't leave the operating room until it looks great to me. Everybody in the room has a say and they all are happy. And I want the patients to be happy, and they almost universally are. But I always think that there's something that could be just a little bit better. And that's what drives me.
Okay.
It's crazy, I know it, but
No, I don't think. I mean, you hear about all the people who are great at what they do. Like, if you walked out of there every time thinking you hit a home run, there'd probably be a problem.
Oh. You feel like you hit a home run when you take something that was a real mess and you made it natural, and you say, "Gotta save this person's life," or really change their lives. But most cosmetic surgery, you're dealing with something that's normal and trying to improve on normal. So you're walking a very fine line, very fine line. And the kind of the expectations of people have changed so much, particularly now with all this media exposure. More and more people are having surgery that makes them look less like people. I mean, it's kind of frightening to me that you have these 65-year-old celebrities. What makes you a celebrity? His faces are folded so tightly, have ping pong balls in their cheeks, and everything is pulled back, and there's not a wrinkle on their face. And you see if they smile, their face is going to crack. And people actually are seeking that, which A, repels me, and B, I think is insanity.
Yeah.
Instead, you want to look the best you can look for you. You want to look like a happy, living human being.
Right.
You want it's crazy. Somebody in the room has to have common sense.
That's so interesting you say that, because, of course, I'm in Miami. I see people that they have one surgery, they have two surgeries, they have three, and you look. At the end of the day, I understand whatever makes someone happy, that makes them happy. I just don't think that they're aware of what it's becoming and what it looks like. And what I mean, doctor, is it's often that we have seasons. We have like an insanely now Miami's busy year round, but we have a part of the year that it's just insane.
Yeah.
And we see people come in town, then they leave, and when they come back, you can see the marks on their face, and their face is shiny, and they look completely different because they've been gone for 6-7 months. And I just don't think that they understand that. It's not normal to look at a 70-year-old who's trying to look 40,
Nuts. That's crazy.
I don't know. What are your thoughts?
I couldn't agree with you more.
Yeah.
That's exactly the way I feel. And you're supposed to look the best you can look for your stage in life. And by the stage in life, I mean, you're young or you're middle-aged, you're an adult. But if you just take a 70-year-old and you're trying to make your face look like a 40-year-old, you take a look at your hands, and it's just different.
Yeah.
And there's no reason in my mind that a 65-year-old woman can't be really hot and still look like a 65-year-old woman. Just great. A couple of miles, and she knows what's going on.
Yeah.
And she's just beautiful. And that's what you seek. You seek to look the best for your time of maturity.
Mm-hmm.
I mean, anybody has to look old. You want to look good. You want your skin to fit. You want to look natural and nice. And real. Real is a word that's not used too often.
Oh yeah, it's interesting what comparison is the thief of joy, and there's a lot of comparison going on. And I understand that. I'm certainly addicted to training because it makes me feel good, and I know that it gives me more energy, and it's going to help me live longer. Now, certainly there's a line. If I go over that line, it's probably going to be the law of diminishing returns. But with the body, I feel like, and who better to talk to about this than you? It's possible when I say to do too much, meaning you may start to damage the skin, and I don't want to put you in the crosshairs here, but
Do it. No, do it. Do it.
no, but like if you do too much to the skin, doesn't it lose its quality or no?
You mean surgically do too much to the
Yeah,
skin?
like let's say I have 5 facial surgeries. Over time, doesn't that take away from the natural quality of the skin, or not necessarily?
Actually doesn't.
Okay.
If a surgeries are done when at the right time, if they're done because you have redundant loose skin,
Okay.
then all you're doing is making your skin fit. Then
Oh,
it doesn't change it at all. And there are so many people that have had 2 or 3 facelifts over the years that just kind of look the same way forever and look natural. It doesn't change the quality of your skin at all. It changes the way it looks when things are pulled as tight as a bed sheet in the army.
mm,
That's kind of dumb. But we're not talking about that. That shouldn't happen.
okay. You pioneered limited incision facelift technique.
Yep.
So did you see some sort of, I guess, bridge or area that you could kind of, I guess, streamline or optimize to come up with that concept? What were you thinking when you came up with that concept?
It was pretty clear. I my teachers and the people I watched who were leading plastic surgeons of the day all did exactly the same operation on every patient at every stage of life. So, 48-year-old woman and a 78-year-old woman would get exactly the same operation. There's no way that a 48-year-old woman has the same problems that a 78-year-old woman has. It's
Mm-hmm.
just not that way. So the stimulus for me was doing things that are appropriate for the issue. So that what are the problems of a younger person? Because I always believe doing little things early were better. What are the problems that a young person has? It's kind of sagging of the cheek, a little bit of jowl, a little bit of a nasolabial fold. But those things were only addressed by doing a full face and neck lift, like was always done before. And they were doing this incision in the hair. So when they pull up the sideburn, the hair would start here at the top of the ear. So if you look at the old in old movies, the old movie stars, the hairline started at the top of the ears
Mm-hmm.
because it had facelift after facelift and it pulled it up. So the first thing I did was make the incision in the sideburn, in the last little follicle of the sideburn. So you pull up the skin, but you leave the hair where it was before. And that A, makes the operation less invasive, B, a natural hairline, and C, you can open it like a zipper anytime you want. You're just taking out skin and you're not changing anything else.
Mm-hmm.
And the incision is completely invisible because the hair follicles cover it.
Mm-hmm.
So that was a revelation to me. And I was applying it first to younger people. And then with a few tricks of the trade over the years, I began to apply it to older people. And I was able to eliminate the incision behind the ear. And so I don't want to get too technical about it, but it started out as an operation that was appropriate for younger people. And I learned how to apply it to people a bit older. And it became the gold standard in the country. And I didn't even talk about it until I published a paper on the first 1,000 that I had done.
Wow.
It was a peer-reviewed paper in the best medical journal, and that set the ball rolling.
So that is fascinating. 1,000 people. That's 1,000 people. It's got to be 2.5 years surgery. More. More.
Yeah.
Interesting. So this type of surgery that we were discussing. What's the time frame on a surgery like that? How long does that take in the operating room?
A couple of hours.
Couple of hours.
Yeah.
So you're on your feet, standing over that person for 2 hours.
Not for a minute. I'm sitting down.
You're sitting down.
Yeah, I'm standing up. I can't.
I know. I remember I used to train a surgeon, and he said, "I can't train my legs." And I said, "Why?" He said, Well, because I'm on my legs all day and I can't afford for them to be sore. And my argument was maybe you need to strengthen them so you
Yeah,
can feel
exactly.
better, you know?
Exactly.
He didn't see it my way. So we did a lot of upper body.
I get that. But we most of the operations that we do, other than the body operations of all the plastic surgery, facial operations are sitting down. So
Okay.
it's great. It's great. But I mean, for instance, if I do breast surgery or abdominoplasty and I'm standing up, I really feel it at the end of the day because it's not muscle, it's my back.
Yeah, right, right.
You think about there's a common disease among cardiac surgeons, heart surgeons. They all have terrible arthritis in the neck, and they
Wow.
all quit because of surgical arthritis because
Wow.
they're like that all
Wow.
day. And
Interesting.
everyone that I know has quit because of that.
Oh, goodness.
Remarkable.
Um, that's that makes sense. That's like the iPhone as well, looking down at the
Yeah,
phone.
yeah, yeah. And
Yeah.
these guys have the first of all, the coronary vessels are the size of a pencil, pencil lead. So they're
Mhm.
in there with the loops on, and they're bent into the wound. You just, it's great. You can do it when you're 35 and you're 45, and all of a sudden you wake up and you're 60, you've been doing it, and you can't straighten up anymore.
Right, right. Are you in prior to surgery, are you a caffeine person? Do you have some coffee?
I drink decaf.
Decaf.
Yeah.
Well,
You can ask me why,
yeah, yeah.
and a really dopey reason. Because occasionally I would get PVC, premature ventricular contractions, which are totally benign, and I had that all my life. But if I have a lot of caffeine, I would feel that. I just didn't like the feeling. And I drink so much coffee in the morning that I didn't want to get a caffeine load. I never felt shakes or anything like that. But so I just have always had decaf.
Okay, understood. Uh, I think this is a good time to ask the most popular surgery today, plastic surgery today would be?
I think that the most popular surgery is probably still liposuction.
Wow.
And
Yeah.
liposuction is, kind of a dopey operation that actually works.
Yeah.
You know, you say, really? But
Yeah.
it does, it works.
Yeah.
It's remarkable. That's, I think, the most popular. And breast augmentation is a very close second.
Well,
And then
breast surgery, I'm sorry, doctor, sorry to interrupt you. Breast surgery
breast
to,
augmentation,
yes, to enhance,
enlarge.
not to,
Yeah,
okay.
yeah,
Okay.
is a close second or maybe even first. And then after that comes facelifts.
Hmm.
And then other things are kind of down the list. But in my world, because of what the, the surgery we were alluding to and the papers I've written on it, I kind of painted myself in a corner so that most of my surgery is facelift because that's what I'm fairly well known for. But, I've trained for everything else and I love doing everything else. But you end up doing what you do is what happens. So that most people who associate my name as a plastic surgeon associate it with facelift. I'm not complaining, but just what happens.
Yeah. So going back, you mentioned lipo. Is that all over the map in regards to age?
Yeah, yeah.
Yeah.
But the most people don't realize is that if you become pear shaped a little later in your life and you suck out the fat, you can have loose skin. There are only certain areas in the body where the skin absolutely snaps back into place at almost any age. And that's kind of the saddlebags on the hips. And the reason for that is the skin is really thick, and you never see anybody with wrinkles on the sides of their thighs on the saddlebag. You see it on the butt, you see it on the inner thighs. Look horrible, like elephant skin after a while. But the outside of the thighs don't. So you can suction as much as you want out of there at any age, and it looks great. On the belly, it's another story. You come in and you have you want to get rid of some of that fat on the belly, and everybody has kind of a little figure of eight of fat around the navel, around the umbilicus, belly button, and you can get rid of that, but you have to be really careful about how much fat you remove because an empty bag is uglier than a full bag.
Wow.
It's kind of loose and really unsightly, as opposed to just being a little pouch. So there is a little judgment and again, common sense necessary.
Okay. Okay. And how much uh, impact does muscle tone have on the surgical outcome? Muscle tone. I guess I know you spent some time on that, but do you advise your clients to say, "Hey, resistance training, you need to start doing this"?
I really do. I advise everybody about that. I push everybody before all these weight loss drugs. I would push everybody to do intermittent fasting and to work out. Do resistance training, and I always give them two reasons. One is you're going to look better, and two, you're going to be healthier and live longer.
Mm-hmm. Mm-hmm.
What's the negative?
Yeah.
And you don't have to do it all day. I mean, if you do it for a half an hour, you're doing yourself a great service.
Mm-hmm. Do you?
And so
Go ahead. I'm sorry.
proselytizing forever.
Yeah. Yeah. Do you see a major, because we have social media, we have all these, YouTube, and we have everything is, I got to look great. The people want the butts, they want the muscles, they want to look perfect, which no one is, but we all want to look better. I want to look better. We all want to feel better about ourselves. Do you see a major carryover? Like fitness is about transforming your body. But do you see like that surgery replacing some fitness? I guess what I'm asking is, are there people who just refuse to do the fitness, or is it most people want it to complement their fitness routine?
I think you're right about both. There are a lot of people who think, well, I'll just do this and everything will be fine. But more and more people are conscious of their routines, of their fitness routine. And this is part of, I'm going to the gym, I'm going to the hairdresser, I'm doing all these things. And then I want certain things out of my control. I want my skin to fit too.
Mm-hmm.
That makes sense. I think that the idea of having surgery instead of taking care of yourself is absurd.
Yeah. Yeah. I wish, hopefully, I feel like now I know I'm in a very fitness, body image conscious place, and we feel like Miami's the norm. It's the furthest thing from the norm, but a place like Miami or New York, they're very into their appearance and how they look. And I can appreciate that because that's my field. But that's still not the norm. It's not like that in Pittsburgh or Ohio or different parts of the country.
You're probably right. You're probably right. It's certainly New York, LA, Miami are different than real life.
Mm-hmm. Yeah,
We really are,
yeah.
for better or for worse.
Right.
And it's all the same people. I don't know. The most famous person from Fall River was Lizzie Borden, right?
Good for you. Yes. Yes. I used to walk by her. Yeah. Famous for all the wrong reasons, but that's brilliant that you knew that. But I used to walk by her house on the way home from school, and
Really?
I would always cross the street. I would always cross the street. Yeah.
I love it.
It was interesting. Yeah. I don't know what happened, but I know it wasn't good.
It wasn't good.
Yeah, it wasn't good. It wasn't good. But thank you. You made my day. So, you're operating on everyone, males and females. Is your approach
What percentage do you think of my practice you think are males? Take a wild guess.
because you asked me this question, I'm going to go 60-40 men.
Almost 35% men.
Oh, wow.
It's a lot.
That is a lot. That is
Yeah.
a lot.
It's a lot.
But I'm assuming that that's 40s, 50s, 60s. Yeah, or maybe 50s, 60s. How much do you get in the 30s and 40s?
Of men?
Yes.
A fair number for only two things. One is love handles, liposuction, and the other is gynecomastia, male breast enlargement. Those two things that young guys do. The rest are 50s and 60s, and it's kind of a loose skin on the neck and bags under the eyes.
Okay.
Because one of the things that guys just absolutely won't tolerate is a turkey gobbler under the neck. It just
Yeah.
makes it just, the kids point at it. It just it become very self-conscious about it. It's basically congenital. You age the way your family ages. So that's what a lot of men do later.
Okay.
But men don't mind wrinkles,
Hmm.
not at all. So when men have a facelift, they're never talking about, I have wrinkles or this. They just want to get rid of the jowls and the double chin, the hanging turkey waddle, and they just want the skin to fit. Period.
Yeah. I mean, that's
And that's
fair.
interesting patients. They're they're total wimps compared to women.
Oh, yeah.
Complete wimps.
I
I
believe
mean,
that.
terrible.
Yeah.
However, once they're done, the stitches are out. You never see them again. They're gone. They
Yeah.
don't talk about it. They don't agonize over things. They don't say, "Oh, I have this little list." They don't care. I'm done. I'm out of here.
Okay.
But we always tell the story to accentuate the difference when kid has an accident. A little child falls and needs to be sutured up. Mother will bring the child in, hold the child's arms, and let you do what you have to do and be useful. Father comes in, passes out.
Yeah. That's
I
true.
mean, all the time.
Yeah.
You look at him, he gets white, and this big guy is.
Yeah.
You have to take care of two
They
patients.
say, yeah, everyone's a tough guy until they deal with
Yeah,
the real
feel the
situation.
blood, and they're gone.
Yeah. Yeah. Does your approach with men and women differ? The way
Yep.
you approach, the way, I
Yep.
mean, I
Yeah.
know I'm stating the obvious, but how does it differ?
Well, it differs because I understand that what their goals are different,
Hmm.
and it you know it, it's actually, I don't know how to say this in a nice way, but um, it's easier for men to relate to women, to um, be liked by women, and it's more difficult for men to relate positively to other men because other men are looking at them and saying, "Oh, this guy's full of crap." You
Mm.
know, it's that kind of male thing. So
Yeah.
you need to find a way to get through that.
Hmm.
And the way I usually get through it is that this is honest. If you don't like it, go someplace else.
Yeah.
And it's just as simple as that. But I really have no difficulty with male patients at all. I think that it's kind of it's amusing to see them say, "Really, I want to do something to look better," whereas a woman can say that instantly.
Yeah. Yeah.
Guys, I'm so embarrassed.
That's right.
Stop it! Come on, you're going to the gym. Stop it.
Yeah. Yeah. I know that's accurate. It's even in my field, it's accurate. Like if someone's vain, they're vain. I mean, it is what it is. Like I don't fault them for it. At least to have the awareness to know what you are, that's having a high EQ, right? Great self-awareness, you know.
And it's our business.
That's right. That's
You
right.
and I are in the vanity business.
That's right. It is what it is. So,
And we're helping people,
mhm.
but you have to call it what it is.
Yeah.
Just
Yeah.
thank God for vanity.
Yeah. That's right. So
Right? Pretty cool.
how do you address the psychological side? Just trying to ensure, or maybe you don't touch it because, like, hey, your business is do the surgery and make a great impact and do a great job. But do you address the psychological side in ensuring that the patients are doing it for the right reasons, whatever that means?
We do that, and I think it's critical to do that.
Hmm.
Uh, it becomes easier to do as you have more experience. But I would say this straight away that cosmetic surgery does not save a marriage. It just doesn't. Suddenly having bigger boobs doesn't save a marriage. It You have to, as you say, you have to be doing it for the right reasons. You have to be doing it for yourself. You have to be doing it because it's appropriate. And it's pretty easy to see who falls into that category and who is a little over the red line.
Right.
People come in who've had a zillion surgeries, and every surgeon they've gone to all the wrong surgeons. Thank God I finally found you. That's somebody you don't want to touch.
Oh, wow.
You know,
Yeah. Yeah. Yeah.
You're just next on the list. That's all.
Oh man, that that couldn't be a more truthful statement. If they're talking negatively about everyone and then they come to you,
Yeah.
you
Come
are
on.
next on the list,
Come on.
1000%.
Yeah.
It's true.
I'm just human.
That's right. That's
I'm
right.
not perfect.
Um, so there's a side of surgery, but there's also the non-surgical, like injectable side.
Yep.
What role do the injectables play with the surgical side? Do you promote it? Do you encourage it? How does that work?
That's a good question because it's a very, it's much disputed.
Hmm.
I think that there's a wonderful place for injectables. It's a quick fix and does a little bit, and it's not permanent.
Okay.
And it can be reversed easily. So that is all good. I think most people overdo injectables, end up looking like they have filler face, because it is, after all, not normal tissue. It's hyaluronic acid, and it's soft, putty, and it's great to fill a little bit of nasolabial fold or other places, or a little bit around the cheekbones and that sort of thing. These little lines at the sides of the mouth, and same as Botox is fabulous, but I am a firm believer that if you need to have significant use of fillers, you should use fat transfer.
Okay.
Because fat transfer is your own fat.
Hmm.
It's you. A good percentage of it gets the blood supply and is permanent, and it looks and feels like you. It looks and feels like normal human tissue, not like filler. So if you put the same amount of fat in the cheekbone area and nasolabial fold area as you same amount of fat as filler, you look like a doll, with a filler, and you look like a normal human being with fat. It just is different. People complain that fat is not a quick fix. To have this procedure, it takes an hour, this and that, and costs much more. But if you look at the cost over 2 years, 3 years, that costs much less.
Yeah.
Downtime for a fat transfer, it's just the day that you do it. I mean, you can go back into a meeting the next day.
Wow.
There's nothing going on. It's just nothing.
Mm-hmm.
So, I mean, we always tell people that things like microsuction and fat transfer, microsuction being a little suction along the jawline, a very thin little cannula, or getting rid of the double chin that way. So a little microsuction and a little fat in the places where it's necessary is transformative. And the downtime is the day you do it. You're back to work the next day with no sign of anything.
Mm-hmm.
Those, I can't say that they're non-invasive. They're minimally invasive, and they are the single kind of most rewarding thing that a patient can do as a quick fix.
Right.
It's just great.
Mm-hmm. Okay. With your practice, that's very helpful. Thank you. With your practice and you're a business owner, I'd imagine if you could put a quick number on the amount of plastic surgeons in Manhattan, how many do you think there are now? Really? That many?
Oh, hundreds and hundreds.
Hundreds.
Yeah.
Hundreds.
And now there are plastic surgeons like myself who are trained as general surgeons and then did a full plastic surgery residency. And then there are ear, nose, and throat surgeons who then take a 1 year or 6 month fellowship in facial plastic surgery.
Wow.
And they call themselves facial plastic surgeons. So that doubles the number of plastic surgeons.
Mm-hmm.
There must be in New York City in excess of 500.
500.
Yeah.
Okay.
And Miami's a hotbed as well.
Oh, I can only imagine.
And it used to be, probably before your time, but before I started in my early career, the University of Miami was really well known for plastic surgery because there was a man named Ralph Millard, a doctor named Ralph Millard there. And Dr. Millard was gifted, and he developed the first, to my mind, great, almost undetectable way to fix a cleft lip. He was a genius at that, a genius at almost everything. And so Miami became a hotbed for training plastic surgeons, but they didn't stay there because Miami wasn't, there was no Miami yet. You know, it was a couple of months and then everybody fled.
Yeah.
But now Miami is a very active plastic surgery community. And of course, as you say, it's full-time residents. You know, and it's kind of fun. It's kind of nice place to eat there.
Yeah, it's a good place. It's certainly a good place. So I'd say what advice would you give to fitness professionals like me who are trying to help people transform or be comfortable with their own skin? Like, how do you advise them? Because they're going to be asking us, hey, should I just get surgery? I've had 2 clients actually who had surgery and they were like, you know what, I worked so hard, I lost all this weight. They had either loose skin or they just wanted to have surgery because they've been working for 10, 15 years. And I was like, you know what, if that makes you happy, like, I don't fault anyone for it. What advice would you give fitness professionals?
Well, the first thing is that you can do an enormous amount with the body, but you cannot tighten the skin. You can't. And the more you do with the body, the sleeker and the more voluntary muscle, long muscle building that you do doesn't help the skin one whit. But it does make the patient thinner. And at a certain point in life, that loss of fat, even on the face, from working out the loss of facial padding, which happens naturally, leaves a haggard look. And it just is so depressing to be better on the inside than you ever were, not so good on the outside.
Yeah.
And there's really nothing you can do about it because so far as I know, there's no workout for the skin.
Right.
There are a bunch of dopey things like facial exercises. Facial muscle exercises give wrinkles.
Yeah.
That's what they do.
Yeah.
Period. But everything else is what you're doing is so important for through the life of every patient. And I like to say that you're baking a cake and I'm putting on the frosting.
Yeah. Well, the frosting's the best part, right?
Well, that's the best part. We like that. That's what you see, that's the part you lick. But it's really something that we work together in you and I.
Yeah.
Because we have exactly the same goal, and we should have exactly the same patient/client.
Okay.
It should be exactly the same.
I'm going to have to start a referral system to your practice. We're gonna have a few. So I talked about this earlier. You have a great list of top 5 exercises that are important or maybe to stay away from. So if you want to give a list of things to stay away from, maybe 2 or 3, and then maybe 2 or 3 exercises.
The only one I know to stay away from is running.
Please.
High impact is the only good thing about high impact, honestly good thing, is bone density. It does increase bone density. There are other things that can do it as well. But the high you get from running is not worth the damage you're doing to yourself. And I don't mean somebody who runs a couple of times a week and runs a mile or 2. I mean people who become obsessed.
Yeah.
Because you never see a serious decade-long runner who doesn't have a haggard face, who doesn't have lost all their facial fat and have loose skin on their face. Mm-hmm. And if you look at a movie and you watch lovers running down the beach to each other, you not only see the woman's breasts bouncing up and down, but you see her cheeks bouncing up and down.
Yeah.
Come on.
Yeah.
No woman would run without a running bra, but her cheeks are bouncing up and down when she's running. It's just so dopey. Plus, the impact, as I was saying, from riding, everyone loses a little bit of height over the years because of the discs thin out, the vertebral discs thin out. You lose a little bit. But if you're doing something with high impact, you lose more. So if you want to get shorter, this is a great thing to do. Run will help you get shorter. The other things, or your hips wear out, your knees wear out, your ankles wear out. You know, how many times do you have to know that? How many people do you know have had their hips replaced? How many people? I mean, every sport takes its toll.
Right.
And again, it's like a little bit of common sense. I just don't get it. If you can get on the bicycle, you can get on the elliptical, you can get on a Peloton type bicycle. You can do a million things to get your heart rate up and to get the same high. You can cycle through Slovenia. Who cares?
Yeah.
But do something that doesn't hurt you.
Yeah.
That's the only no that I can think of. The other things are things that you must tell your clients that don't be a big shot and start yanking weights that are too heavy for you, because ligaments go also and joints go also, and it's crazy, and you don't want to tear your biceps, that sort of thing. But other than that, I just look at the various muscle groups, and I think I encourage people to do arms and chest, and do abs and legs.
Okay.
And they're just such simple things. And I usually try to either start or finish every workout with 25 push-ups.
Right.
Because I know it's over at the end.
Right.
And it warms me up in the beginning.
That's right.
And there are a lot of things that I personally don't like to do that other people do that I have to force myself to do. Like, I've forgotten what it's called when you pull the bar down, weights in the bar.
Lat pull down. The lat pull down.
Yeah, lat pull.
Yeah.
For some reason, I hate it.
Yeah.
So,
Yeah, that's not my go-to, but I do it frequently. I do more pull-ups. I like the activity of a pull-up, and I feel like the basics serve me very well. So
yeah, pull-up is a real exercise.
yeah, yeah.
I think push-ups are real exercise too.
Oh yeah. I mean,
it's,
Yeah.
I never heard of planking until recently, but
Really?
this is planking and exercise.
That's right.
It's really a good thing.
Oh, great. It's
And
great.
you just feel so good when you do it.
It's a challenge, right?
Oh.
So we covered the training and fitness side. What about recovery? And I'm talking about in regards to the skin. Are you a fan of sauna, traditional, infrared, cold plunging?
That's a great question, and I don't know the answer. Because the cold bath, that cold immersion's become hot.
That's right.
Well, every athlete also, and it is no question that it's good for taming immediate inflammation. It kind of it stops the progression of inflammation to a certain degree. It also is a terrifying thing to think about getting into.
Yeah,
It just
certainly is.
and the other things, I have no knowledge of what the sauna or steam actually do, so I don't want to posit anything.
Understood. Okay.
What do you think? What do you think?
I mean, I like sauna. I think it's proven that the sauna can be very helpful. There are studies. I don't know how large the sample size is off the top of my head, but really assists you in fighting early onset Alzheimer's. So there actually is data behind that. So I try to get in there, 4 times a week, 20 to 30 minutes. And I feel good when I sweat like that. And I'm really sweating.
I love the sauna too, but I just do it because I like it.
Yeah. Yeah. But there is data around that. In regards to the cold plunge, if my body's thrashed, I used to get in there all the time post workout. Now the science has shown if you get in prior, which sounds crazy because then you got to warm up, but it actually preps your body to be in an optimal state to actually boost testosterone. So, if you go in post, you actually kind of halt or stop the adaptations that are happening from the resistance training.
But they also stop the inflammation.
Oh yeah, no, for sure. So I tell someone, look, if you just went in a marathon run, get in the cold plunge, right?
It helps.
Yeah,
No question. themselves. Now, if you pitch 9 innings, nobody pitches 9 innings anymore.
That's
But if
right.
it's only one guy on the Dodgers, but if you pitch 9 innings, you have to wrap your arm in cold. You just got to do it. It's just it's real.
That's a very good point. So I think what happens is Gen Pop quite often confuses themselves with professional athletes. And I say, look, a professional athlete, he's getting paid to get back out there. That's completely different from you training 5 days a week in an air-conditioned gym. You know, that it's very different. But they don't want to look at themselves as different. You know,
there was I see these guys who who pitch 3 innings or 4 innings and get pulled, and I remember there's always been stories. There was this classic pitcher for the Brooklyn Dodgers 1,000 years ago, a guy named Don Newcomb.
oh yeah,
Big guy, and he at least once, maybe more than once, pitched both ends of a doubleheader during the day.
wow,
15 innings.
wow.
He would lose an average 12 pounds.
Wow.
He pitched both ends. And these guys get yanked after 3 innings.
Yeah. It's
and all my friends who do the Tommy John surgery, these guys, the old days, a fastball was 85 miles an hour. These guys are throwing 105, and so they're tearing everything up.
yeah. This might not be a fair question for you, but in regards to Tommy John, how much of at this point, Tommy John sounds like it's inevitable for every pitcher that gets worn out. But how much of that is genetic factors, in your opinion, and how much is just wear and tear?
I know nothing, but what I hear, I've asked the same question, and I have a bunch of friends that take care of the teams,
Mm-hmm.
and they feel it's from the speed at which guys are trying to pitch,
Okay.
how much stress they're putting. It's not genetic at all. It's just from it's occupational.
Yeah. It's wildly traumatic. Wildly traumatic on that joint. Wild.
Wow.
Yeah.
It's insane. The idea that they can come back and they're faster when they come back.
Yeah. Yeah.
Remarkable. There's a guy, sadly, who just died, a surgeon named David Olchek, was a very dear friend of mine. He was at HSS, Hospital Special Surgery, and he was a doctor for all the teams.
Mm-hmm.
And he was one of the first people to do that surgery. And he did it innumerable times. And he used to tell me that what a wreck these guys were and how the next year they were throwing faster.
Mm-hmm.
Just like amazing. I mean, it's a career saver for these. It's a career saver.
Yeah, for sure. Yeah, absolutely. In regard, I know we're on the topic of athletes. In your world, do you see high use or get a lot of questions around the subject of peptides? No, not really. I was wondering because, we think after surgery, you want everything to heal naturally. You don't want to, correct me if I'm wrong, you don't want to interfere with the recovery process. You want it to do it, function on its own. Yes?
Nicely correct.
Okay.
You want to let nature take its course.
Okay.
And, it's always right. It always happens. Mm-hmm. And it doesn't matter what your age is. Almost everyone heals at the same rate within reason.
Mm-hmm.
Nature, we don't monkey with it.
Mm-hmm. Okay. Where do you see surgery going in the next 5-10 years? Do you see any advancements on the horizon that some things are coming in the next 5-10?
Well, earlier in our talk, I said this is just nice knife and fork surgery, mm-hmm. and it hasn't changed, and I don't see it changing. And over the decades, all the new advances turn out to be not advances at all. Go back to the old ways. And the only really, in cosmetic surgery, the only really new thing in the last 50 years, really new, not just little tweaks, has been liposuction.
Okay.
Liposuction started in the 80s and this French guy named Louis gave a talk, and everybody thought he was insane. You're doing what? And then it took us a little bit of time to catch up to it. It was the only new thing that was instituted, significant thing in plastic surgery. The type of facelifts, they vary up and back. And, I make a little contribution, another guy makes a little contribution, but it's all based on the same thing. People try to use computers for things. They try to. What happened in my office, actually, the guy developed a computer program to predict what you're going to look like after surgery. It was a sales tool. It took so long, to show the patient, and then it was a lie, because you can't produce what you can produce on a computer screen is not what you can produce in life. You're dealing with tissue. That's more. The only place where computers have done a remarkable thing is in craniofacial surgery. People who have all the bones in their face, children who have abnormalities, the computers are able now to mold everything and predict everything, see everything in 3D, and actually plan the entire operation before the patient's even at the table.
Wow.
It's really, really remarkable. But in day-to-day plastic surgery, there's no place for any of that.
Okay.
We do what our forefathers did, and maybe we do it with a tad more sophistication.
Okay. Understood. Do you have, to close this out, do you have one specific surgery that you are most proud of and you were like, wow, like I really got to give myself a pat on the back for that one? Obviously not naming names, but talking about the surgery itself?
Other than, no, there are some. There are some. And yeah, there are a few. And it's remarkable. I come home once in a while and say, I really did something terrific today. I really changed somebody's life.
Wow.
It maybe happens a few times a year, but when it happens, you've undone so many of your sins. It's just a good thing. It's a good, wonderful about it. I love what I do, and I think I help people all the time. But there are times when I've just done something that has changed someone's life for the better, and you have a little one sneaking in behind you.
This is my wife.
I thought she was
Melanie. Say hello to Dr.
She was bending down. I thought
she has to grab something from the office. This is Dr. Imber. Say hello.
I saw you sneaking in.
The truth is she wants to ask some questions about surgery. I'm just kidding. Yeah.
Wonderful to meet you.
She's in trouble.
You.
So yeah, she's amazing. So I can't thank you enough for being on. I know I've gone over the mark here, but I really appreciated our chat and enlightening me. Keep impacting people, and I really appreciate you making time to do this because I know you're extremely busy. So thank you.
Well, first of all, we asked really good questions.
Thank you.
Intelligent questions that it was a pleasure to talk about. So I thank you for that. And that makes such a difference. And the time went by so quickly, it was clear I had a good time.
Oh,
so
appreciate that.
Thank you very much. It was really great fun.
Likewise.
I hope I get to do one of these days. It's terrific.
That's right. If you're ever in Miami, please, I'd love to connect for a cup of decaf.
Yeah.